the need for you to stay back home whenever you have any health challenge, because we've got experts that can handle any kind of health challenges. So you don't need to, waste your hard-earned naira, convert it to dollars, and jet out. We have all it takes to, fix any kind of health challenge in Nigeria. And today we'll be looking at the importance of wellness. Yes, wellness. You just be marveled. Why wellness? Yes, it's an aspect that we all need to know, and we need to take it very serious. And of course, to do this, I have with me a consultant, gynecologist, and obstetrician. Well, most times they say obstetrician and gynecologist. He's from Alliance Hospital. Hey, I must say a very big thank you to Alliance Hospital for supplying us with, human resource when it comes to this program. We have been seeing them at different times supporting us with human resource. I must say thank you to Alliance Hospital. So a very good morning to you, Dr. Mike and Kela, for your time with us on the program this morning.
Thank you very much. It's my pleasure to be here. And viewers, good morning to you all.
So let's hit the ground running. Wellness. I know many of us may just be hearing that for the first time, in relating to a discussion such as this. But generally, wellness. Tell us about it.
Yes, thank you so much. In the form of a brief introduction, recently in Nigeria and many parts of the world, we've had a whole lot of sudden death among young, enterprising individuals in the society. And when you sit back, you discover that it's not just necessarily have to do with your physical fitness at any point in time that makes you whole. It has to do with the entire being of an individual. And that's why this concept of wellness has a little bit of addition apart from health. Health, as defined by the World Health Organization, is a state of physical, social, and mental well-being, and not necessarily the absence of disease or infirmity. But when you come to wellness, wellness has to do with a state of living that healthy lifestyle. So the difference between wellness and health in the real sense is the fact that wellness is a habitual act of living a healthy lifestyle. So if you say somebody is well today, or somebody is healthy today, what does it take for the person to be healthy tomorrow? What does it take for the person to be healthy in the next 10 years? It means that that person needs to live a well, healthy lifestyle to be able to maintain that health status. So wellness, or the concept of wellness, wellness center, wellness clinic, as it were, is to ensure that we live a continuous life of good health, total, wholesome, entirety of the individual. And if you look at the statistics about Nigeria, it's not very encouraging when it comes to health. You talk about life expectancy in this country right now. It's one of the worst in the sub-Saharan Africa, and of course one of the worst in the world. A child that is born today in 2021, you would not guarantee that child is going to live till maybe 2080 or 2090. Because is in another couple of 50 something years, you are expecting that the person may eventually die, and that is really, really appalling. So, but one of the reasons why we feel that this has become a burning issue is the fact that a lot of young enterprising individuals have died in recent time, which we feel, if they had taken this concept of wellness seriously, we feel that they shouldn't have died.
So what are the components of wellness?
Thank you very much. The components of wellness stands on various pillars. If you're looking at the wholesomeness of an individual to be well, you have to look at the physical, which unfortunately is what many people look at to say somebody is well, but it's not just the physical. You have to look at the social well-being. You have to look at the emotional well-being. You have to look also into the occupational well-being. You have to look at the environmental well-being and even the spiritual well-being of an individual. These are strong pillars that determine the well-being of an individual. If you're looking at the physical is usually if the person is physically fit,
he can move around,
is able to move, is able to eat, is able to probably talk and then interact. But that's not enough. That's why you hear people go to the ocean side and then you just park their car by the roadside and jump into the water. You know, if you look at, they may be physically fit, but emotionally they were not fine, and otherwise they're not fine. So you look at all these concepts: physical, emotional, social. You looked at the environment, look at the occupational, even nutritional. All these constitute the entirety of the individual's well-being, and that's why, if I'm to maybe expatiate a little, the concept of this wellness center or clinic that will enhance the well-being of an individual has to do with having a established wellness center where, even though the individual is moving around, is doing every other thing normally, so to say, in the house, he can walk into the wellness center and seek a consultation. And when we seek a consultation, we looked at the person, we took accurate history. And you see, it will suffice it.
Does it have to do with medical checkup? You know, complete medical checkup?
Yes, it's a component of it. When you talk about that complete medical checkup, you're bringing in the physical well-being now, which is very important, really. Because when the person comes for a checkup or a clinic at the wellness center, we take good history. You see, history is very important. There are some genetic related diseases. There are some diseases that are transmitted from generation to generation. So the history of the individual is important, the kind of job he or she is doing, and then, of course, the age, all of that put together. Then we'll be able to decide what kind of investigation, what kind of test the person should undergo. You know, it's not until the person is now having pain in the head, pain in the chest before you walk into the... No! Even in your good state, so to say, of health, you walk into the clinic. And then you say, you just want to get yourself evaluated by the physician or by the doctor. And then we ask you a lot of questions. Let me give you an example. Somebody called me not too long ago, earlier in the year. And we're just talking. And then he said, I just asked, and then he said, the challenge he's having is that of headache. The headache comes on and off and all of that, but it doesn't stop him from doing any normal activity. He goes about doing his activities, and he felt that it's really not him much, and a headache. I said, no, I think you need to get to see a doctor. They need to evaluate you. For a while, I never heard from him again, until one day they just called me. I was traveling, and all of a sudden he couldn't move. He couldn't talk. And then we took him to have some investigation, did an MRI, CT scan rather. We did a CT scan and discovered that there was accumulation of blood in the brain, what we call subdural hematoma. And so he was practically paralyzed because he couldn't speak, couldn't do anything again. Then, of course, my colleagues have to bore a hole into the brain and to bring out the clots of blood and take care of wherever the bleeding was coming from.
What is responsible for that?
It's because people don't go for a proper clinical or medical evaluation. Even when there are certain signs, we still tend to bear them and carry on with them as if it's part of those things we could. Some just attribute stress. They just say, well, I'm stressed up, and that's why. But even stress is one of the things we manage at the
So
wellness
tell us
clinic.
the relationship between wellness and sudden death. You know, recently, many people, including those that the people believe that they are always on the move, they are always, you know, engaged physically. Some of them dropping and dying. So tell us the relationship between this wellness and sudden death.
Yes, thank you. Like I said earlier, that's one of the burning issues in our heart why we're trying to promote this wellness center, a wellness clinic. Because sudden death, if you look at statistics all over the world, sudden death is it's a death of an individual that happens within minutes or hours without any violent provocation. That's simple definition of sudden death. You see? So you see somebody just go to bed and the following morning just come meet him dead or her dead. It's happened severally. And we think that one of the key factors why people die suddenly without any diagnosis prior to their death is because people have not made use of this wellness clinic. And because they are able to stand and talk and move and do things, they don't get to. By the time a young man gets to in the late 30s, 40s, it's expected, or a young woman as it were, it's expected that you present yourself once in a while for a wellness clinical evaluation. Because
how regular? When you say once in a
yes,
while,
yes.
Once in a while could be once in 10
Yeah, that's
years or
why.
something.
Very good, very good. That's why at the first presentation, we take a good history. We look at certain risk factors. Take, for example, somebody that have a risk factor of a heart disease, cardiac disease. I saw a young woman just last 3 weeks that has a heart, a valve in the heart. I wouldn't expect such to be far away from a regular visitation to the clinic, at least twice in a year.
A valve in the heart.
Yes, a change, or he has a artificial valve. You know, that's because he has an underlying heart disease. You know, so then those that never even had such an experience, and then you get to an adult age, say 40 years, it's expected that you get to the clinic at least once in a year to have a wholesome evaluation. Now, when the doctor detects certain factors in you, he can advise you, please come twice in a year. Let's get you checked. You know, so the frequency would depend on the individual. You understand? And then, like I was trying to explain, a lot of people are going about hypertensive, diabetic. They never knew. A lot of people are going about with even malignancies, that's cancers that is just brooding, and they never knew. I was listening to the news, I think 2-3 days ago. One of the presenters on CNN was said to have a cancer of the ovary.
Yeah.
You know, and just yes, few weeks ago we had the celebration of the World Ovarian Cancer Day. I remember personally I was on air talking about the Ovarian World Cancer Day. You know, the people get to
I remember, and you did say that if you don't breastfeed, it's a risk factor.
Yes, yes.
One of those many risk factors.
Yes, you remember that, one of those risk factors. Yes, exactly. You know, because we've discovered that ovarian cancer, it's more commoner with women who are nulliparous. Nulliparous means they've not had children, and then women who also have not breastfed, women who undergo regular menses and changes in their ovary. The ovary keep undergoing different changes every month during the menstrual cycle. So if you know you have such a factor, or you have a family history of ovarian cancer or breast cancer as it were, it's expected that from 35 years of age, you get to see your doctor. And there are certain women that will get to take out their ovary early, so that, you know, the risk is much more reduced in them. You know, so
in Nigeria, this is the crux of the matter.
Yes.
You have talked about the importance of wellness, and of course you are taking us to what has happened to one of my colleagues, of course, I'll say my colleague in the international media. And I know in that particular event, we're all there, and so many media stations too were there. And when you were giving us the risk factors, and not too long, we just discovered that one of us actually has that. And all of that will be channeled to wellness. If there was advantage of wellness taken in any hospital, that would have been detected, and it wouldn't have gotten to that stage. So in Nigeria, where do we assess this wellness? Where is the wellness clinic?
Thank you very much. I'm aware in Nigeria there is high need for wellness center. There could be other
because many people are jetting out to have these things
done
abroad.
Yes, there could be other places really. But currently, I'm very much aware of the one in Alliance Hospital. And you know, in Alliance Hospital right now, it's a multidisciplinary setting where you can assess any kind of care that is replicable outside
primary, secondary, and tertiary
primary,
care.
tertiary, all levels of care. There are instances where expatriates have to be flown from outside the country into the hospital to carry out procedure. Just like, you know, whether it's neurosurgery, spine surgery, you know, OBGY, obstetrics gynecology, whatever. And so that is why the center is well positioned right now to be able to offer these services. Because, you know, even the wellness clinic we're talking about, there are some people that will come in for rehabilitation. They have had stroke, you know, cerebrovascular accident. They have a gait problem. They can't walk well. There are people that need plastic surgeries. You know, all of these are the services that Alliance Hospital is offering. And then we expect to even offer more as the challenges increase. So also we increase our potentials and
so what is the success story like?
Very good, very good. It all depends on what we're looking at, because primarily the wellness clinic is aimed at preventive care. That's the primary one. You want to ensure that, okay, if somebody is at the risk of developing cancer, he or she doesn't eventually develop it. I see wellness, the concept of wellness center, wellness clinic, is to give people informed choices on how to live their life.
So what you're saying is, if anyone takes advantage of the wellness clinic,
yes,
the person may not be able to have knee replacement surgery. The person may not be able to have hip replacement surgery. There may not be kidney transplant. There may not be brain surgery. That's what you're saying in a sense.
Yeah, to a certain extent, it is. Because take a look at it. If somebody is at the risk of developing osteoporosis, which has to do with the weakening of the bones and all of that, a woman who has attained menopause, who has reached her age of end of reproductive career, there are evaluations carried out for her. Is she on any kind of drug? We do all of that to be sure that she is not at the risk of having a hip fracture or getting to the toilet and falling down and having a broken bone and then come for a hip replacement. So if she has such care, that risk is going to be highly minimized. It goes also to elderlies. If elderlies access the wellness clinic and they are properly counseled, properly treated, they would have less reason to fall down and have such injuries and then coming back for such surgeries. So we believe that the wellness clinic will go a long way in preventing a whole lot of clinical conditions that present at the late stage. And that's why you can never overemphasize this concept in the real sense. You can't overemphasize.
Yeah, but now let's talk a little of your specialty. I'm sure it will also be interesting, just as wellness is. Honestly, the way you have said it is, I'm just getting something pinching me and telling me, why don't you make our time and take care of some of this. Once in a while you have some pinches here and there in your knee, in your joint, you know, there are some kind of food you eat and you are not comfortable. You know, you have to get some kind of fruit to actually, you know, reduce the discomfort, so to speak. Obstetrician and gynecologist. Tell us about the concept of IVF.
Okay. Thank you very much. Okay, do you also know that even the wellness clinic have a component of gynecology?
Wow.
Yes. Yeah, because we provide services that can prepare the woman or the man, the couple, for fertility. We call it the preconception care.
Wow.
You know, preconception care. We try to put that into this wellness clinic. So it's not like they're sick, they come in. And so if those services are given, the tendency for a couple to have challenges in conception may be reduced. And then the need for assisted reproductive technique, what you probably are referring to as an IVF, may also be reduced as much as possible. You know, in IVF generally, it has to do with assisting the couple who have not been able to reproduce on their own to be able to attain reproduction. And of course, there are different levels of different methods. It depends on the challenges of the individual couple that we're dealing with. If it's a male factor infertility, there are things we do. If it's a female factor, which is the commonest for female factor, is the tubes could be blocked, or we call tubal blockade. You know, in that case, it may be necessary for us to take the woman's egg, the man's sperm. There are processes we subject those sperm and egg to, and then we'll be able to incubate them and then transfer them into the woman's uterus at a particular time. Bearing in mind that the uterus would have been prepared with certain medications given to the woman to prepare the uterus. So this is actually the concept of IVF. But see, it's a function of the type of procedure, is a function of what we think is responsible for the infertility in the couple. And if the woman comes into the wellness clinic, we ask a lot of questions and we do just a few investigations. It doesn't mean, even a young lady, I had a young lady the other day that came in and said she just wanted to determine her reproductive status. She's planning to get married and she wants to be sure that she's fine. And I asked her a few questions to determine what we should do. I discovered she had features suggestive of polycystic.
Okay, sorry, let me hold your thought there. Hello, good morning. Hello, good morning. Please, can you speak up? Hello. Your name is what? Okay, tell us what's your question or comment. Hello, I can hear you. Okay, I've been seeing so many calls coming in. It appears the network is not too friendly. So many here, but just go on.
Yes.
Even though we have barely 3 minutes to wrap up.
Oh, really? It's always the time is always not our friends when we come talking about health. But like I was trying to say that even the wellness clinic has a component for fertility that an individual could work on.
Hello, sorry, doctor. Hello, good morning.
Good morning, sir.
Your name and where are you calling from?
My name is Mr. Chidi. I'm calling from Abuja.
Okay, quickly, your question or comment?
My question is that I have chest problem.
Chest problem?
Yes, in my chest. I'm feeling my chest like say that there is stroke. And I am feeling that next day, stomach hurt. I don't know what it's all about.
Okay, doc. He has chest problem. He doesn't know what it's all about.
Thank you. I can't get his name properly, but
Chidi.
Chidi. Okay. Thank you, Mr. Chidi, for your question. It's important for you as a matter of fact and urgency to get to see one of our colleagues in any of the nearest center, or you get to a wellness clinic, because chest problem is very, very critical.
Okay.
Close to your heart, close to your lungs. We can't tell from...
Okay, sorry. I'm sure that would have satisfied you. You need to see any of his colleagues. Okay, quickly. Your name and where you're calling from?
Yes, I'm Abu Manar.
Okay, good morning, Abu. From where?
From Gogolada.
Okay, quickly. Tell us your question or comment.
Actually, I'm just impressed with the program, and I'm learning a lot of things. I'm getting to understand a lot of things. Thank you very much, Doctor. Thank you very much, ITV and the presenter as well.
Oh, all right. Thank you. Thank you.
I'm just following here in the house. We are all watching.
Okay. Thank you very much.
Thank you very much.
Thank you, Mr.
Thank
Abu.
you, Alliance Hospital.
All right. Thank you. Okay.
Yeah, so, and you see, this concept, it's very important right now. We've had incidences, we have people coming in late presentation with complicated conditions, which would have been checked. Recently, I have somebody that had a blood pressure of 200 over 120.
Wow, that's a terrible one.
And they didn't know.
Let's okay, the very last one now. I want to take. Okay, 200 over 100 is a bad one.
Yeah, and the person.
Hello, sir. Okay. Let's take this from this lady. Hello, good morning. Your name and where are you calling from?
Good morning, sir.
Good morning. Your name?
Hello.
I can hear you. Good morning. Your name and where you calling from?
Hello.
Good morning. I can hear you. Okay, Doc, let's wrap up on this.
Well, I know network is a challenge at times like this. So, generally, I want Nigerians to understand that this concept of wellness center, wellness clinic is very important. Most of the deaths that occur are preventable deaths. I don't believe that, we rationalize and say a lot of things about deaths, because of our religious inclination. But you see, most of the deaths are preventable. If people assess the wellness clinic, we can determine ahead of time the risk factors and treat them, manage them. Even cancers too are preventable to a large extent. So I encourage as many as possible, assess the wellness. The Alliance Hospital is open and we attend to all cases.
Thank you so very much, Dr. Mike Anakola. He's the consultant obstetrician and gynecologist, Alliance Hospital here in number 5 Malumfashi Close, area 11 Abuja. Thank you so much for your time. We have looked at